Philadelphia 76ers star Joel Embiid has been diagnosed with Bell's palsy. In this video, we'll explore what that is and how it's affected this NBA superstar. In mid-April, Sixers star Joel Embiid noticed something was wrong. He first thought it was a migraine, but then realized it was much more. He noticed that the left side of his face wasn't working properly, especially his mouth and his left eye. In typical Embiid style, he said, "I'm going to keep fighting through anything. I've got to keep pushing." But in the following game, despite feeling something was wrong, he scored 23 points and had 15 rebounds to send the Sixers into the playoffs against the New York Knicks. After seeking medical attention, he was diagnosed with Bell's palsy. What exactly is Bell's palsy and how does it affect the eye and visual performance? Bell's palsy is a condition where the muscles of the face, typically on one side or the other, don't work properly. There are an incredible number of muscles on the face, in fact a total of 43. The majority of these muscles are controlled by a single nerve, coming from our brain to the face. This nerve is called the seventh cranial nerve, and when not working properly, it creates a Bell's palsy condition. Unfortunately, although we know where the problem is, we don't exactly know why it happens. The causes of most cases is unknown, but it's likely related to swelling or inflammation of this nerve to the face. What we don't know is why the nerve swells. Typically, Bell's palsy can affect young adults between the ages of 15 and 45. Men and women are both affected equally, and it occurs between 7 to 40 cases per 100,000. That doesn't sound like too many in terms of cases, but if you're affected, then it's 100%. Other medical conditions that may cause Bell's palsy include high blood pressure, obesity, diabetes, and even pregnancy. Clearly not the case with Embiid. Typically, symptoms start over a 48 to 72 hour period, and the onset is pretty sudden. In most cases, the deficits last a few weeks, but it may take months to fully recover. So what are the symptoms? In addition to weakness on one side of the face, which by the way, can on rare occasions involve both sides of the face, there is drooping of the eyebrow and mouth, often with drooling. There may be headaches or jaw pain, as well as an increased sensitivity to sound. In fact, this could be a problem for Embiid during the NBA playoffs. Now that we know why it happens and what the symptoms are, the next question is, how can we treat it? To cure it? Unfortunately, the condition isn't curable, but there are treatments to lessen the symptoms and to help it resolve faster. Quick diagnosis and treatment is important and can shorten the length of disability, even though the symptoms are temporary and will eventually resolve on their own. These treatments include steroids, medicine against viruses, as well as moist heat and possibly physical therapy. Embiid doesn't have much expectations about when this case will get better. He understands that it could be weeks or months and has said, "I've got a beautiful face and I don't like when my mouth is looking the other way." I bet though that after dealing with this, he has a better understanding of how his eyes are critical to sports performance and how any small disturbance can impact his effectiveness on the court. Let's hope that Embiid makes a full recovery quickly and is able to perform at his best for years to come. If you like this video, you may also enjoy reading my new book called Eye of the Champion. This book details the role of vision in sports and performance and includes tests and training to help you understand how to maximize your vision for optimal sports performance. The book, as well as the audiobook and ebook, are all available on Amazon. Also, press the like button and subscribe to the button to be notified each week when we release a new video. Until next time, thanks for watching and best wishes for maximal success.